A surgeon in a windowless basement peels off his gloves, counting a stack of cash no hospital would ever see. But here's the twist. This isn't just a crime story, it's a finance story with a scalpel pointed straight at the world's broken healthcare systems. Most people think black market surgeons are just criminals preying on the desperate. But if you zoom out, the real question is, why does this market exist at all? And what does it reveal about the way money, medicine, and desperation collide? Let's follow the money trail, because it's a lot more complicated and a lot closer to home than most people ever realize. To understand the underground surgery economy, you have to start with a single, stomach-turning number. In the US, the average cost for a simple hernia repair, about $20,000 if you're uninsured. In India, you can get that same surgery for less than $1,000 at a private, legal clinic. That's a 20x price difference. And that gap? It's where the underground market sneaks in. Now, imagine you're uninsured, or an immigrant, or simply broke. You're in pain. The legal system says, pay up or suffer. But there's always someone willing to offer a cheaper solution, if you're willing to risk everything else. Here's the first thing most people miss. The black market isn't just about profit. It's about unmet need. Take Alex, a construction worker in Texas, injured on the job, no insurance. He's quoted $18,000 for basic surgery. That's more than he earns in a year. A friend whispers about a guy who can fix it for $2,000, no paperwork, no questions. Alex knows it's illegal. He also knows it's his only shot at working again. And here's where finance comes in. The black market surgeon is selling hope at a price the system refuses. So, who are these underground surgeons really? Not always the monsters you'd expect. Some are disgraced doctors stripped of their license. Others are real doctors moonlighting for cash. A few are just frauds with a scalpel and a YouTube diploma. Those are the horror stories you hear about. But the weird part? Some black market surgeons have better track records than legal clinics in the same country. That's because desperation breeds two things: exploitation. One underground surgeon in Venezuela started using 3D printed parts to fix bones because the hospitals had none. He's technically a criminal, but to hundreds of patients, he's a hero. But don't get too comfortable. There's a reason the risks are so high. No regulation, no oversight. Mistakes are common and deadly. Infections, botched surgeries, and no legal recourse. You can't sue a ghost. In the Philippines, one underground clinic was shut down after a single procedure killed 3 people. But here's what's even scarier. Shutting down one clinic barely dents the demand. The economics are relentless. If you can't afford the official price, the unofficial market always finds a way. It's supply and demand, but with lives on the line. And it's not just poor countries. This happens in rich nations too. In Los Angeles, illegal dental surgeries are advertised on WhatsApp for a fraction of the legal cost. It's the same story: uninsured, nervous, and out of options. So why don't people just travel for cheap legal surgery? Medical tourism is real, but it's not for everyone. Passports, visas, travel costs. If you're broke, that's still a mountain. And if you're undocumented, crossing a border isn't just expensive, it's a risk you can't take. So the black market isn't just a plan B, it's often plan Z after everything else fails. Here's where the money gets weird. Some underground clinics are more profitable than legal ones. No taxes, no paperwork, no malpractice insurance. Overhead? Almost zero. The result? A black market surgeon can make $10,000 in a single weekend. But blink and you'll miss the cost. One lawsuit, one mistake, and it's all gone, or worse. So why don't governments just crack down harder? They try. But for every clinic closed, 2 more pop up somewhere else. It's a game of cat and mouse, and the patients are the ones who pay. Here's the real tragedy. The black market for surgery exists not because people love crime, but because the official system fails so many. If healthcare was affordable, safe, and accessible, these markets would dry up almost overnight. But as long as the price gap stays this wide, the underground will keep thriving, no matter how many documentaries, raids, or horror stories you see. You might be wondering, would you ever take the risk if the system failed you? Or is this just a distant problem for someone else? Here's a twist most never see coming. The same logic that fuels underground surgery also drives other shadow economies. Whenever the legal price is out of reach, a parallel market appears, sometimes dangerous, sometimes ingenious. And it's not just about money, it's about trust. When people trust the legal system, black markets shrink. But when trust vanishes, when prices soar and waitlists grow, desperation fills the void. That's why some of the world's most famous medical pioneers started as outlaws. Heart surgeon Christian Barnard performed illegal operations before he changed medicine forever. Today, some underground surgeons are quietly pushing boundaries because the legal system won't. But for every pioneer, there are dozens of disasters, and the price of failure is always paid in flesh. So, if you're thinking this is just a story about greed or crime, think again. It's a story of economies, above and below ground, filling the cracks left by policy and price. And it's a warning, when you price health out of reach, you never eliminate demand, you just shift it to the shadows. So, what's the real cost of a black market surgery? It's not just the money you pay. It's risk, it's trust, it's the price of being left behind. And as long as the official system keeps failing, that's a price millions will keep paying. So next time you hear about a black market surgeon, ask yourself, is this a crime or is it a symptom? And what would it take to make these markets disappear for good? Now, about that surgeon in the basement. Was he a villain, a hero, or just an answer to a question nobody wants to ask? In the end, the black market for surgery isn't just a shadowy corner of medicine. It's a mirror held up to a healthcare system that's left too many outside. And the real question isn't how to stop it, it's what it would take to make it unnecessary. If you thought the black market for surgery was wild, wait till you see how a global shortage of medicine is fueling a new underground economy. The story gets even darker and even more personal. But let's rewind for a second. How did surgery get so expensive in the first place? Insurance paperwork, hospital admin, and malpractice lawsuits have turned every procedure into a bureaucratic maze. In the US, hospitals spend an average of $2,500 per patient visit, just on paperwork and billing. Malpractice insurance premiums for surgeons can exceed $100,000 a year in some states. That cost doesn't vanish, it gets passed on to patients, inflating prices even before the scalpel touches skin. Here's a counterintuitive twist. In some countries, price transparency actually lowers black market demand. In Singapore, publishing the exact cost of every procedure slashed the shadow market by almost half. But in countries with hidden fees and surprise bills, desperation grows, and so does the underground. Another irony, sometimes, hospitals indirectly push patients toward the shadows. A study in New York found that after Medicaid cuts, ER visits for black market complications spiked by 30%. The system saves money up front, but pays double cleaning up the fallout. And here's a number for you. In 2022 alone, U.S. hospitals billed uninsured patients $130 billion, most of it uncollectible. But the underground? Cash up front. No chase, no collection agencies. That's why the black market isn't going anywhere soon. It's frictionless for desperate patients and desperate providers. Now, let's flip the script. What happens when underground surgery goes digital? Telegram groups and encrypted forums now connect patients with underground surgeons worldwide. Some even offer video consults, just like legal telemedicine, but in the shadows. A few underground clinics even advertise on Instagram, using code words and emoji. But the digital underground makes mistakes even harder to track, and patients even easier to exploit. One wrong word, and you get scammed, not stitched. Meanwhile, regulators can barely keep up. The dark web moves faster than any bureaucracy. But in the end, the online black market is driven by the same logic: price, trust, desperation. And as long as that math doesn't change, neither will the reality underground or online. Here's a new curiosity. What happens when innovation outpaces regulation? DIY biohackers are now 3D printing surgical tools and even attempting minor procedures on themselves. One viral video showed a man draining his own cyst after being turned away by 3 clinics. This sounds extreme, but it's a symptom, a world where official help is out of reach and Google becomes your only doctor. And here's the kicker. Every year, a few of these biohackers stumble onto breakthroughs, discoveries that the mainstream system later adopts. But for every accidental genius, dozens end up in the ER or the morgue. So the line between outlaw and innovator, sometimes it's as thin as a suture. In the end, the shadow economy of surgery is a symptom, not a disease. A mirror for every place where hope is rationed and the price of relief becomes unbearable. So what would it take to make the black market obsolete? Maybe radical transparency, universal coverage, and a system that sees desperation as a diagnosis, not a crime. Until then, the scalpel in the shadows keeps moving, one patient, one risk, one desperate hope at a time. And for every story you hear, there are hundreds you never will, because when the official doors close, the underground always answers. Remember, the real villain isn't always the man in the basement. Sometimes, it's the system upstairs. And the real cure? It's not more police. It's fewer reasons to knock on the underground door. The story of underground surgery isn't over. In fact, it's just getting started. Next time you see a news story about a black market doctor, look closer. It's never just about crime. It's about supply, demand, and the human cost of every price tag. And as long as hope has a price, the shadows will always be open for business.